Okay, why don't we go ahead and get started? It's a couple minutes after. We might have other people coming on, but I am recording this so that way then anybody who's not able to join us this morning is able to see the information later on as well. A couple of housekeeping things before we start. If you have questions throughout, there's two ways you can ask them. You can either type them into the chat bar and ask them that way, or you can unmute yourself and ask as we go throughout. And I'm sure at the end there'll be time for questions as well. And I'll help facilitate those questions, guys. So that way, because I know when you screen share, it's hard to see chat stuff come in. So if we get anything in chat or whatnot, I'll facilitate that. But with that, I'm going to turn it over to the Insurance Center, and I'll let Heidi let you guys introduce yourselves and get started.
Wonderful. Well, good morning, everyone. My name is Heidi Steffen. I'm a corporate benefits specialist here with the Insurance Center. And joining me today to my left is Ronnie Matzel, and she is our account service representative here at the Insurance Center. And I just want to fill you in a little bit on my background. So I've been with TIC for almost 5 years. And I love it. I love it here. I love helping you all with your employee benefit packages. Before that, my background is really in human resources, and so I'm really familiar with everything that kind of goes on in that arena. And before I came to TIC, I actually worked for a home builders member, Hasselwander Companies, and I was there for a number of years. So I understand like what you guys do, right? And your clientele, and also your employee base, and how important it is to retain and recruit all of those good employees in this Chippewa Valley area. So I hope that you find some information that we present today to be really beneficial in that aspect of your businesses. So just a little bit about TIC. We have 13, I want to flip it. We have 13 locations, and we're headquartered in Onalaska. We were founded in 1960, and we are a family-owned business. We primarily started our growth helping dairy farmers in Wisconsin. And so that's really where we started, and we're a full service brokerage, so we help with all kinds of things, not just employee benefits, but we can help with work comp and your property casualty things and all of that. I am located here in the our Eau Claire office, and we're just a couple blocks towards the mall from Red Robin. So the WBA Health Insurance, because you're a member of the local chapter, you obviously know you're a member of the state chapter, and because of that membership, you are eligible to partake in this association health plan. It was introduced in July of 2018. It's available to both current and new members. And you actually don't have to be a member at the time that we go to quote for you. So, I can go out and talk to people who even might be an affiliate member, and this is an option. It's also an option that we're hoping that drives membership. It has a robust network of providers. So it's using WPS, which maybe you're familiar with, but it has the nice statewide network of providers. Basically, anyone in our area is going to be included in that network. So we have Oakleaf and Marshfield Clinic and Mayo Clinic and Sacred Heart, all going to be part of that robust network. There's also a national network wrap using the First Health Network. So in the event that someone is traveling, you would still have coverage even if you leave the state of Wisconsin. It's available for any calendar month. So I know like right now, probably benefits might be top of mind because we're entering, sadly, the fourth quarter is going to be here next week. So, but you don't have to wait till January to get on this plan. You can get on at any time during the year. What the hope for the WBA Association plan is that even though you might be a small employer, we need at least 2 people on the plan in order to offer the plan. So you and 1 employee would be enough, right? But it allows for large group purchasing power. And what that does is it helps drive down the costs. We can go out, so really anyone who's a member of the state association, think of it like that umbrella, right? Anyone under that WBA umbrella is all buying. So like you're all one big group. And it allows us to drive down costs. And really the WBA association plan is one of the only association plans in Wisconsin. It was established, as I said, in 2018. And after that, they kind of have went away with association health plans. So it's really cool that it's in effect. So part of being a part of that large group purchasing power, we also hope to drive down the annual increases. So if you have a current group health plan now, or you've heard maybe some horror stories about group health plans, it's like you can get into the group health plan, right? And maybe the rate is good for you for 2019 or 2020. But then you use the plan, your employees use the plan. So in 2021, all of a sudden you see a huge increase in your rates. The average renewal increase for all of our members, this is statewide, has been about 4%. I will tell you that on average, you could expect, even outside of this WBA plan, about an 8 to 10% increase regardless of usage of the plan, simply because everyone gets a year older. So if you're age rated, I'm 29, next year I turn 30, I'm going to go up into that next age bracket. So it's really been super cool and beneficial that those rates have been really reduced at about that 4% level. You can get a quote by contacting me through any of our offices though, really. So even if you have offices in other areas of the state, we can help you. It's really simple. You reach out to me. We get what we call a census. Basically, it's a spreadsheet of your employees. We need their name, their date of birth, and then if there's any dependents that need to be on that, including a spouse, children, we would need their date of births as well. From that, we go to market, we get the quote for you to see where the premium would come in monthly. Now, speaking of premium, it is the federal guideline law, basically, that if you offer a health insurance plan to your employees, the employer has to pay 50% of the single premium, employee only premium. So if it's me on the plan, I'm your employee, you pay 50% of whatever my premium is. The rest of that would be payroll deducted and on my behalf. Now, you could always pay more, okay? You don't have to though. And then if I have a spouse or children on my plan, you do not have to pay any of their cost. You can, you don't have to. The law is 50% of the employee only. And groups continue again to add every month. So word of mouth gets out there, it's a great network. And again, you can add it any time. It's always effective on the first of the month though, however. So we would be really looking at now, because next week is October 1st, the soonest we could get you on the plan would be November 1st. There's a lot of added value benefits associated with this plan. So not only do you get the health coverage, and there's different plan designs with the health coverage, but you also get a $0 drug list. So all the plans have prescription drug coverage, but there's a $0 copay on select preventative drugs. for certain common conditions. So if someone's on high blood pressure, high cholesterol, if they have a heart condition, some diabetes meds, asthma meds, those right now, maybe they're costing a lot of money to your employees. If they're on this plan, some of those drugs would cost them nothing. We want them to take their preventative meds, right? Because they are preventative and good to be taken as preventative measures. There's 100% of certain in-network preventative services. So when I say certain, it's routine medical exams, immunizations, routine eye exams, well baby checks, mammograms, some other preventative screenings like a colonoscopy. Now, one thing I like to tell all of my groups and their employees is when I go in and I schedule my preventative visit, I schedule that. I always tell them wherever I'm going, I'm in, I want to come in for my preventative screening. Unfortunately, the way medical coding happens oftentimes, I would think that I want, I go in for my preventative, I want to talk about a mole that's bothering me. I often recommend that you schedule 2 appointments for those types of visits so that you get your preventative at 100%. Reason being, if I bring up my mole or a certain other condition, they could now code some of that as diagnostic, and I may or may not lose my preventative 100% screening. So it's just kind of a caution that I let people know. There's also telehealth. So maybe you've used telehealth because of the COVID situation and are safer at home, but telehealth is super awesome. It's 365, 24/7. You can connect with a licensed physician over the phone or via video consult like we're doing today. And it's $0 if you're on a copay plan. If you're on a high deductible health plan, it would be $45. And you can have that visit. So if you think of it, if you use the telehealth services, and I would recommend for certain things like, when your kiddos have pink eye, right? You don't have to take them into the clinic to get the diagnosis of pink eye, but you need the prescription. I would call telehealth. Doc looks at the child's eye. Yep, they have pink eye. They'll call in your prescription. Certain things too, like a UTI or just things, strep throat even, like there was a story that I was told. They called in, doctor said, say ah, they held the phone up, they look in the throat, yes, you have strep throat, I'll send you the prescription. So it's really cost conservative and cost effective to use the telehealth rather than going to the urgent care for the visit. There's an iMed Vision Care discount program. So it's included, there's no additional cost. You can use this at thousands of locations and save on eyewear and eye exams, all of that. There's a Here in America hearing plan. So you can get one no-cost annual hearing screen. And I know, being a contractor, right, you're working with power tools and loud things around. So definitely encourage you and your employees to go take advantage of no-cost hearing screens. You can get discounts on 9 top hearing aid brands. There's a 3-year warranty on covering repairs, loss, and damage with all the purchases of those hearing aid brands. And you also get 3 years of batteries. There's an exercise rewards program. So if you work out at least 10 times per month at a qualified fitness center, you'll get $30. I do know for sure the Y is included in our area. I'm not 100% sure on any other gyms, but we could easily find that out for you if you have questions on that. Any further questions? Lots of information there. But we're open to questions if you have any.
I have one about how this would work in conjunction with another insurance plan. So say you use this as secondary, or you have a secondary insurance in addition to this.
So typically with health insurance, it's one or the other. Okay. A lot of times with dental insurances, they can partner, but it's either or in regards to health insurance. Do you have a spouse that has a plan that you're on now?
No, I'm personally on TRICARE.
Okay. Yep. So in that, I would say stay there. Simply because it's less expensive, okay? And the benefits with the TRICARE are going to be better than what this plan offers. Now, if you see yourself coming off of TRICARE, you can get on this plan at any time, again, on the first of the month. So sometimes, a change in income or however that would work, you can get on this plan at any time. But my advice is stay on TRICARE as long as you can. Oftentimes too with that, depending on, being self-employed and income situations, for groups out there, if your children qualify for TRICARE but you don't, this would be an option. You can come on and always keep the kiddos on the TRICARE plans. Any other questions?
I have another one. If you go, you said you need at least 2 people on the plan. Does one of them have to be the owner, or can it just be employees?
It can just be employees, yes. Where we run, in our area, we have a lot of independent contractors. So if it's the owner and they have 1 or 2 employees and the owner doesn't want it, they can get on, but we need at least 2 people on the plan, and it doesn't unfortunately work if it's just 1 independent contractor. Good questions.
Heidi, can you talk about how they would go about if they wanted to get a quote and how that process would work? If they wanted to find out if the plan would be a fit for them?
Yeah, so there's no strings attached to getting a quote, okay? No cost to you. Again, you'd reach out to me here at the insurance center, and we would send you the spreadsheet, the census, that you would fill out, compile of all of your employees. Regardless if you know today if they want it or not, we'd like a list of all of the employees, first and last name, date of birth, and we could start there. You don't even have to gather dependent information at that time. And we would go get a preliminary figure for you, okay? And after we get the preliminary figure, I'd sit down with you, we'd go over that, go over what it looks like budget-wise for you. And then these plans are medically underwritten. So what that means is after we get that preliminary figure, we would need your employees to fill out an application. Again, no strings attached. Even if we go to step 2, have employees do the application or waiver at that time, then we can still always back out. So once we get the applications, we send those off to WPS. They take a look at health history, and if there's any certain conditions in the group. And then they rate you accordingly, okay? So I'll just give an example. High blood pressure, not a deal breaker, okay? If there's maybe, for example, a maternity, someone is currently pregnant, that could potentially increase our preliminary quote slightly. And they look at that simply because if the baby is premature, that can be a high dollar claim, okay? So that's just one example of where we might see a little bit of fluctuation from a preliminary number that we initially show you to our second medically underwritten number. A lot of young male employees in our groups, right? They're carpenters, they're out there. Those typically are rated really really lightly, okay? Healthy young guys. So if you have a lot of healthy young guys on your crew, great plan to really seriously consider. Once we get the final number and you say, yes, we're going to implement this, Ronnie and I put together packets. You've already had your employees do applications, so no need to do any further application. This rate locks in for the year that you're in. So we'll be looking at, you could come on for the remainder of 2020 or looking for January 2021. Even if you have a new hire that comes on board during your calendar year or your year, November to November or whatever it is, the rate never changes, okay? Even if you hired someone that maybe has a heart condition or a medical condition, where they would reevaluate is again on our renewal, okay? If that clarifies anything there. And then we also come in, we have employee meetings at whatever works for you guys. So we can do pre-shift meetings early in the morning. I can do a lunchtime meeting. I can do an evening meeting, whatever works. But we come in as an arm of your team and talk to your employees about the plan, tell them how it works. And then also we help you with any compliance that you have, any questions your employees come to you and maybe they're having a claims issue, you can refer them to Ronnie or myself and we help take that off of your plate.
If anybody else has any other questions, feel free to type them in chat, or if you are on a phone and you're muted, I believe it's *6 to unmute yourself. If you'd like to ask a question and you're calling on a phone, it's *6. So basically just, and so if you're interested in just finding out if it's kind of a ballpark price range, you can do that by contacting the insurance center, giving them some general information on your employees. Before you actually go through and have your employees do anything, you can get some general ideas of what the ballpark price would be to see if it's a fit for you or not.
And typically what we've been seeing with that ballpark price, it's pretty accurate. So there hasn't been a lot of upcharges, so it's a really good way to gauge where that's going to put you in your budget. And we know it's expensive. Employee benefits can be the second most expensive line item in your budget. However, it's so important in those tools for recruitment and for retention to hang on to those good employees.
All right, I'll give just a sec if anybody has any other last minute questions. Feel free to type those in. This was our first round of the benefit brew. And so we thought obviously with the timing of this, the insurance program would be a great fit to highlight this first time. We're looking to do these virtual meetings throughout the next year to try to give you guys some different input and ideas as to what you guys are getting out of membership, some of the different aspects of membership that people don't always think about. So if you have any suggestions for future topics, something you'd like to learn more about, please feel free to share those, type it into the comments or the chat section, or shoot us an email back and let us know, because we're going to be working on scheduling some additional ones of these, looking at some different areas. Obviously, the Wisconsin Builders Association is a big part of your membership, and this insurance program that came out a couple years ago here has been was kind of a big win for the organization as a whole statewide, because insurance can be a big challenge, and this has been a way to allow some of our small businesses to be able to offer something at a more affordable level. I know we have a few members on this. Heidi, do you remember how many members that at our association we currently have on one of these plans?
I don't even know. I bet you we're probably close to a dozen now.
Okay.
Yep.
Yeah, so we do have quite a few members that are on this. I saw a list at one point, but it's been a while. So we do have quite a few members that are on this plan. So it can be a great option. It's not the right fit for everybody, as Heidi had said when Alicia had asked, no insurance is perfect for every situation, but it might be a good option. If we wanted to be able to kind of share more about this here with everybody as our first start at our benefit brew. All right, I don't see any other last questions. So anything else as we wrap up here, Heidi, you wanted to add?
I just want to thank you again, Christina and Christy, for allowing us to come on the first benefits brew. And as I mentioned, we should have had an afternoon benefits brew, because then we could have had a different kind of brew. But we're glad to be here. We're glad to be a part of the local chapter, Chippewa Valley Home Builders Association, and we're glad to represent the WBA program and help you guys with all that entails for you. So thank you again.
All right, well, thanks guys so much. We're right on time here for 9 o'clock, so I'll get you guys out in a half an hour. So thanks everybody.
Thank you. Have a good day.
Thanks. Bye.